Ohio had nearly 34,000 cases of COVID-19 on May 28, 2020. Let's take a look at how age factors affected patient outcomes for these cases. This chart lists the totals of the major categories where the blue bars are cases, orange bars are hospitalizations, and gray bars are total deaths. Across the bottom are the various age brackets, with people over 80 being on the left and people under 20 being on the right. Note the fairly consistent distribution of cases over all of the age brackets. Every age bracket has over 3,000 cases. The one exception to this is the under 20 group, which has less than 50% of the cases of any other bracket. You can also see how hospitalizations break down in the orange bars across the age brackets. The death counts are listed as well. One thing to note is that the under 20 group with 1,466 cases has had 0 deaths so far. Now that we have looked at total counts, we can determine how each different age bracket contributes to the total. The first thing that jumps out to me is how people over 80 have only 11% of the total cases, but 53% of the deaths. It also shows that people in their 70s have 9% of the total cases and 25% of the deaths. Combining those two categories, people aged 70 and older account for only 20% of the total cases, but 88% of the total deaths. On the other end of the spectrum, people under 30 account for 0% of the deaths. People under 40 account for 1% of the deaths. And people under 50 account for only 3% of the total deaths. When we know the number of cases and the number of deaths, we can also calculate the death rate per case per age group. The math works out this way. We start with deaths per age bracket, then we divide by cases in that age bracket in order to get the death rate per case per age bracket. Put another way, this explains if someone is diagnosed with a case of COVID-19, what is the percentage chance of their death? This chart summarizes the previous table, and it shows that people 80 and older have a death rate of 30.54% once diagnosed with COVID-19. Those in their 70s have a death rate of 17.1%. Those in their 60s, 6.5%. And those in their 50s, 2.06%. All age brackets for people in Ohio below age 50 have a death rate of less than 1%. For those in their 40s, the death rate is 0.64%. For those in their 30s, it is 0.27%. For those in their 20s, the rate is 0.13%. And for those younger than 20, since there have been no reported deaths, the rate is 0.0%. But age factors are not the only factors that need to be considered. There is an important statistic that is very relevant to death rates that Ohio does not publish, but other states do. That statistic is comorbidities. New York, the state with the highest death count, reports that nearly 90% of all deaths overall of COVID-19 had at least one comorbidity. That means that people without one of these conditions was much less likely to die of COVID-19. Having additional information on comorbidities would be helpful in gaining greater understanding of the data in the future. Thanks for watching. I hope this video has increased your knowledge of how age factors affect outcomes in COVID-19 cases.